Stephen came into this world on his due date, on his own, December 22nd.
As soon as he was born is when we found out that he had extremely severe heart issues. And they said, you can take him home and he'll die in a few days, or we can do a reconstructive surgery and he might live a few months. The day after Christmas, they did his first surgery when he was 4 days old.
I grew up with Schoen's heart complex. It's a congenital heart disease consisting of 4 different defects to the heart. I was a little more limited with what I could participate in because I just couldn't keep up physically.
We did our best to never ever hold him back from things.
There's no book written about, at the time, for what to do for Schoen's complex that anyone seemed to have. Anything that we found simply said that people didn't live. That's all it said. There was no hope.
He developed pneumonia in the fall of 2012, went into heart failure, kidneys failed, liver failed. He was sick and was dying.
We had a new technology. It was called TAVR, T-A-V-R, or TAVI, and it held some promise in that we could replace his aortic valve without open heart surgery.
So this was a bit scary to us because you really don't want to be the experiment. You want something that's going to work. But our options were limited. We need a new aortic valve or we need a new heart.
Stephen's TAVR was unique in many ways. First of all, he was 19 years old, and as far as I know, he's one of the youngest patients to ever had TAVR. Usually we use the femoral artery. Well, in patients with Schoen's complex and many of these adult congenital patients, the arteries are much too small to put him in. We use his carotid artery, which for a young patient actually is quite a good approach.
The procedure was successful. They had good deployment of the aortic valve of the TAVR.
Stephen's been able to return to a normal quality of life since his TAVR. His prognosis is excellent.
I'm a senior in computer science at Clemson University. I can't even describe how much more energy I have and how much better I feel. I could walk from one end of campus to the other without taking a break or without breathing heavily.
I think if Stephen was born 1 year earlier, he may not be here today. He was really on the cusp of what the technology was able to offer him.
You have to go with the hope of the technology being ahead of what you need. And in Stephen's case, we're very, very grateful to not only see that happen, but also to have the medical professionals in our midst that can help him.
And we're glad the valve is working so that he is able to do everything he wants to do in his life. And he's still been able to maintain all his excellent grades and be top of his class, so we're very proud of him.
I thank God every day that I had that doctor and that he helped all of us through that process.
Stephen's heart health today is a gift, and we are very, very grateful for how well things are going for him today.